Bend, pluck, place, repeat. For hours a day, workers at Nature Sweet Farms pick tomatoes. It's work that requires strength, skill, and good health.
If you think about it, everything for harvesting crops, for packaging them, et cetera, and stuff, it is built to make it happen fast. It's not built to protect the body of the workers.
The National Center for Farm Worker Health says the top 3 things farm workers suffer from are obesity, hypertension, and diabetes. Workers do what they can to prepare for the day.
When we enter, first we have to exercise, stretch out, then we put all the protective clothes on for the greenhouse.
Though they grow healthy food, some farm workers struggle to maintain their own health. Access is a problem.
Particularly precarious with farm workers is the type of labor they're involved in, if it's shift work versus ongoing or formal employment. And so some people might have health insurance and health coverage and others may not.
The National Center for Farm Worker Health says almost 53% of farm workers are uninsured. And even if they do have health insurance, the ratio of people to doctors in rural areas is 2,500 to 1.
It's not saying necessarily that we don't have enough health professionals. It's saying that they're not distributed well throughout the country.
Here in Winchester Heights, an unincorporated Latino neighborhood just 10 minutes from the farm, there are no doctors. The closest town with a medical facility is 20 minutes away. Enter CHEC, a rural health organization that wants to help the people in this area, starting with the community itself. They've worked with the community to build a center with their own hands.
And I think it represents a little brush or a little touch of humanity and has brought out the goodness of a lot of partners and brought together people that normally wouldn't come together.
A big part of that humanity comes with making them feel healthier. They train promotoras de salud, or community healthcare workers like Aida Dominguez, in the center. Promotoras de salud go door to door in Winchester Heights to teach their neighbors about better health.
Una promotora de salud es que
A promotora de salud has communication with the community and provides care for the community, for us to have a healthy community.
Trainings happen in the evening when farm workers are home for the day. Many come straight from work. Others bring their children to the meeting. This is important to them. Latino farm workers say the community center and promotoras have made an impact on their health. 400 people work in this tomato plant. The majority of them work here in the greenhouses, and almost 95% of them speak Spanish primarily. When these farm workers hear people speaking their own language, it bridges the divide.
Es importante para tener como un ambiente social.
It's important to have a social environment and also to be able to help the children, the youth, the adults, the elders, so we will be united.
Learning about healthcare from your neighbors in the place where you work is a powerful motivator.